Well, it's Wednesday morning, has been part of this morning show for over 30 years. My good friend, Dr. Joe Congini, on board with us this morning. And Joe, good morning, my friend. Thank you for chiming in again to the show. What do you have for us today?
Hey, good morning, Ray. I'm stepping across and just kind of looking at the broad spectrum of career in sports and pediatric sports medicine and what we do. And really, I have kind of a spectrum of sport injuries that I just want to touch on briefly that show you a little bit. When we take care of sports injuries in pediatric sports medicine, we don't know the outcomes long-term, short-term. We just know that the number one factor, you and I have talked about this for years, the number one risk factor for significant injuries in athletes that hold them out of being able to play or can lead to surgery and issues like that is having previous structural injuries or significant injuries. Having had previous injuries is the number one risk factor. And in the last 4 months alone, there's 4 cases that just kind of hit me as I was preparing this week and looking at it. And the fact of the matter is not only really affects the athlete, it actually has a very profound effect on the competitive nature of sports and what goes on in sports. So starting in the month of January this year, a quarterback by the name of Bo Nix has an ankle fracture and surgery, and that really had a significant effect on the Super Bowl. Who was going to be able to play in the Super Bowl and whatever, and what was going to be the next step. And as he's rehabbing just in the past week, he's had a second surgery. It's called a cleanup surgery. They're trying to make sure the alignment is good on this ankle surgery. It's great, perfect, because the better the alignment, the less chance of long-term effects of significant arthritis. That's what he's facing. And if you head down that road of multiple surgeries, he'd already had surgeries and injuries and fractures in his career, you could lead to significant arthritis. Then in the month of February, we had the incredible skier Lindsey Vonn, but what a sad issue. She's had a lot of injuries in the past, and yet wanted kind of one on the Olympics this year. And she had a very significant injury that I think we all saw, kind of really scary and frightening injury. And I had heard an interview with her while I was working out yesterday, actually, on the treadmill, listening to her talk. And she's had 8 surgeries since she had that significant injury, and she's trying to work her way back. The big problem in the short run for her was with all those surgeries, she had a question of a thing called compartment syndrome, where you have too much bleeding related to these injuries in the compartment, and you can actually have loss of limb. And so in the early stages, the first week, there was a question as to whether she would lose her leg. And she said yesterday that she is not going to be on, today is the first day that she's going to walk some without crutches since the injury, be able to bear weight without crutches. So she's got a long road to go, but a very significant injury. And then we moved into March and April, and the NBA playoffs are affected by this. Jason Tatum, a great athlete. We're talking about all these people are top 10 athletes in their sports. Jason, and in their position, Jason Tatum, really a lot of people thought was going to lead the Celtics back to the NBA championship they won it a couple of years ago, and the series, if he was going to be able to maintain his health. But we know he came off that very difficult injury, the Achilles tendon, the explosion injury, the loss of power that we get, and so with that injury, we know that many athletes in professional sports and high-level sports, maybe 50 to 70% of them get back to the level of where they were at, and many never get back at all to sports. So we don't know where Jason Tatum is now. He's got work to do. There's a question mark in the future. But in the long term here, is he going to have effects for the rest of his life? And then finally, just this week, it affects baseball too. So I'm saying the spectrum of sports. Here we are talking about football, Olympic sports, basketball, and baseball. Tariq Skubal, that we got a chance to see close up as a Guardian fan, one of the really great young pitchers, elbow problems. he had an ulnar collateral ligament. That's the Tommy John tear in 2016. And later on in 2022, had with his flexor tendon in his elbow. And he is going back. Now, they said that they are going to remove loose bodies. This isn't like your old days of loose bodies where all we had was an X-ray. I mean, we know that behind the scenes he's had a lot of probably significant imaging and evaluation by the sport medicine team, and they finally had to decide on doing some surgery at this stage, which is not a good sign. And in the long run, how much effect might this have on this wonderful young pitcher's career, we don't know. But I use these four examples then in summary, Ray, to say that, number one, first of all, the direct effect on the competitive aspects of sports of injuries is significant. As I just went through, it may very well in the last 4 months have affected four of the biggest sporting events that we go through. So many of these things, number two, start at a young age. So we really feel that it's a very important role that we have in pediatric sports medicine, and we approach it with the whole team and making good decisions, who should play, who not, how do we rehab these people so they don't end up on those long-term, down-the-road risks of more significant injuries. And so that includes our trainers and physical therapists and our primary care docs and our orthopedic surgeons, our sports psychologists and sports nutritionists, and trying to get the best outcomes in the short run for these young athletes so they don't go on to those injuries I talked about in the higher level athletes. And so whether these kids are going to be playing just rec ball, junior high, high school, these can have effects, these types of injuries, on people for the rest of their life. And so it is a big issue that we have, and we want to make sure to work hard to make the best decisions that we can. And it just really kind of hit me that in the last 4 months, 4 significant injuries that really changed the competitive aspects of sports across the country.
Joe, is it inevitable if you have a major surgery that you will get some complications down the road? I don't know if you know the percentage or whatever, but it sounds like it's probably a high percentage, one, maybe in that same area or maybe in another aspect of the body because you're compensating for the injury at some point.
Yeah, that is a number that we don't have because there's so many people that go through this, and many go through it and do well. And that's why I say those initial decisions that are made by the surgical team and the sports medicine team are very, very important. But you're exactly right. For instance, of the 4 I talked about today, the Jason Tatum injury, they say his other leg was affected. They say that he was having actually some knee problems as the Achilles was the original problem with him. And so there are other injuries that occur down the road. You know those things, and we know that those injuries need good attention starting at a young age and good attention to detail on the appropriate rehab, the appropriate period of time that you need to be out. Of course, there's a balance system, though, Ray, of, hey, these are some of the biggest games and most important and kids want to play, but on the other hand is trying to prevent that. And so the better job we do up front, I guess is what I'm saying, the less chance that those fractures and more significant injuries play a role later in their career and even later in their life. That's what I'm trying to say.
Gotcha. Interesting. Very good information, Dr. Joe. Take care of business. And what he's saying, do it the right way and get the physical therapy and get everything taken care of to possibly avoid these down the road complications. Joe, great visit again, my friend. Always appreciate the time.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Big part of this show for 30 years plus.